Hi everyone, so in today's video we are going to talk about OCD, obsessive compulsive disorder, from the neurobiological point of view. We're going to understand which part of the brain is largely responsible for the OCD behaviors, what kind of OCD behaviors are there, what kind of problems they cause in day-to-day life, and how to deal with them, both from the biological and non points of view. Watch until the end of the video. We are going to cover basics of the OCD in this video. I would like to recommend to everybody the book from which I got this information, which is Change Your Brain, Change Your Life. In the previous video, watch up here, I already talked about an ability to focus and concentrate and how that's related to the prefrontal cortex, also from this book. So this book has changed my life. I believe it can change your life because it talks about a lot of neurobiological problems that lots of people face on every day, and there are even tips that you can learn from others in order to prevent. Some of this is going to be also in this video about OCD, how genetics can influence OCD. So the choices you make now are going to influence your generation in the future. So the part that Daniel Amen, the author of this book, has found to be influential in OCD behaviors is called anterior cingulate gyrus. Here is going to be the picture on the screen for you to see where it is located in the brain. The part was found to be responsible for ability to shift attention, to general cognitive flexibility, adaptability in a new environment, going with the flow, cooperation in relationships, movement from one idea to another, and also understanding the errors. A disorder is characterized when this part is overactive or the underactive, according to probably average standard or whatever standard scientists use. And so there are different pathologies in behavior people experience when ACG or anterior cingulate gyrus is overactive. For example, there are going to be people who worry excessively a lot. Together with other parts of prefrontal cortex, it makes it difficult for any decision to be made because people see only negative sides of it and they overestimate, so basically pessimists, they overestimate the negatives that can happen with this. They always feel unsafe, etc. People have struggles with shifting attention. They are stuck on one thought for a very long time. So this can be anything. So eating disorder, people are stuck on their body image. Pain, when people are just stuck on their feeling of the pain and ignore everything else in the world. Saying no, we're going to be talking about all of this later, is the ODD, obsessive defiant disorder, when people just negate anything you suggest to them. Chronic anxiety and worry is also part of overactive anterior cingulate gyrus. That what happens when the levels of activity are low is that apathy, decreased movement, slowdown of speech, etc. And what was interesting to find about anterior cingulate gyrus is it contains a lot of serotonin receptors. Serotonin boosting helps to calm OCD symptoms in some patients. So this suggests that when the ACG is overactive but the serotonin levels are low, people have struggles with shifting attention, stuck on their thoughts and behavior. So boosting some serotonin may help. So what kinds of OCD are there? So I'm gonna name a few. Maybe you have heard some of them and maybe even you have some of it. So please comment below if you have any of those symptoms and how do you deal with them on a daily basis. Very interesting for us. So trichotillomania, the obsessiveness for pulling hair. Onychophagia is biting nails. Then Tourette syndrome, which is different kind of tics, motor or speech tics. Then body dysmorphic image, when people think that some part of their body is excessively ugly for some reason. Hypochondria, autism, compulsive shopping, chronic pain, pathological gambling and different addictions, eating disorder, and oppositional defiant disorder. So we're going to touch on some of them. We're going to start with trichotillomania. There were researchers that suggested that trichotillomania is part of the OCD then when they would perform the brain scans. However, they found that at rest, trichotillomania and OCD are activated in different parts of the brain, so they're not exactly the same. However, when they gave the anti-OCD medication to people with trichotillomania, they noticed a strict decrease in symptoms. So they are related in this manner. In particular, activity in ACG was decreased, and that's associated with a decrease in OCD symptoms. there are interesting cases of OCD-like patterns after strep infection. The author, Daniel Amen, gives an example of a kid. He was 10 years old. He was totally happy, normal child, until one day his throat got sore. So for 1 week, he had a sore throat, and it stopped, but he developed obsessive behaviors. He started washing hands all the time. He was worrying a lot about different things. And so his parents understood that something is abnormal, brought him to the laboratory of Daniel Amen, where they found that his angular cingulate gyrus was overactive. But more interestingly, he was found to have a strep infection. So when he was given antibiotics, the infection stopped, normalized, and he returned to his normal behavior. So yes, infections also affect the brain. Daniel Amen says that he was giving probiotics to the child because, as we know, when people take antibiotics, that affects their bacterial diversity in the gut, which has to be replenished with probiotics. That's why probiotics and antibiotics. We're going to talk about oppositional defiant disorder. This is also what Daniel Amen noticed is associated with angular cingulate gyrus activity, and so can be classified as OCD. What people are, what their symptoms are, is that they just very argumentative. They disagree with everything you say, and if you give them 10 things that are even good for them, they maybe disagree with 7 or 8 of them, or sometimes even 10. What's interesting for this is that it can be traced to the family roots, and we're going to talk about this now. There was a case in the laboratory when some family came to visit the laboratory, and then the little daughter was hugging her dad, saying, "Daddy, I love you." But then when they were driving to the restaurant after they visited the lab, the daddy was suggesting for his daughter to go into the car with him, but she would say, "No, I don't want to." And no matter how he persuaded her, she wouldn't go. She was classified with anterior cingulate gyrus overactivity, so she was oppositionally defiant. What this ended up with is her dad taking her physically, putting her in the car. She was very unhappy, crying half the way, and then suddenly halfway through she said, "Oh, Daddy, I'm so sorry, I was against it. I really like to go with you. I like to be with you." She was a grandchild of an alcoholic, so the OCD, alcoholism is also part of OCD when people are stuck on a thought, so that can influence its future generations. A lot of stress is known to increase OCD. There were studies of children who are oppositionally defined and then put them in the rest or under pressure. So when they were under pressure, their OCD symptoms increased and their anterior cingulate gyrus activity also increased. So that's to keep in mind. And when you put people with OCD under stress, they don't react very well to that. There has been a correlation between alcoholism in previous generations and OCD or ODD in the next generation. So how to deal with the people who have OCD is just to give them options or distract them with. Now we're going to move to the second part of the video, is how to reduce the OCD symptoms. I guess a question that's pertinent to many of you. And just in daily life, all of those things are going to be interesting and sometimes even helpful to you. The first thing is your thoughts and your behaviors. Even though there are medications, but it's important to remember that what you think on a day-to-day basis, minute to minute, is going to dictate your brain pattern. So keep in mind that everything you're doing is influencing who you're going to be in the future. Also, that comes for behavior. And maybe you want to talk about habits later. Let me know in the comments below how the habits are formed, how the neurobiology of habits works. But now we're going to talk about OCD. And why I'm saying this is because there have been patients who were given medication and whose OCD symptoms reduced. Nice. But then there were also the control group who were not given any OCD medication, but just general psychotherapy. And guess what? Their symptoms also reduced. Their angular cingulate gyrus activity reduced, and so on. There are different options for different people, and knowing that psychotherapy works is very reassuring. We're going to talk about nutrition, how to control your thoughts, where to whom to talk to if you have problems, and still it's important to have purpose in life. Yeah, for people who are stuck on some thoughts with OCD, what Daniel Amen recommends is increasing serotonin in your diet. How this can be done? So first of all, those simple carbs, which are pasta, potato, bread, pastries, anything, popcorn, they increase insulin levels and allow more tryptophan, which is a natural amino acid that is a building block for serotonin, to penetrate the brain. Once the brain amino acid is there, it's transformed into serotonin, and so people get this calming effect within 30 minutes. But it's no secret to anyone that simple carbs are not extremely healthy. So if you do not need immediate rebound from OCD, then we recommend to eat healthier foods, which are complex carbs that will give you slower effect but will be better for your health overall. We mentioned the word tryptophan, so eating foods that are high in tryptophan will actually help, which is something that we all know. For example, chicken, turkey, salmon, beef, nut butter, eggs, all of those things are high in tryptophan, and also green peas. So these are lots of proteins, but eating only proteins and no carbs is actually not good for people who have high OCD symptoms. That's because proteins contain other amino acids that are easier to penetrate the brain. And so the L-tryptophan is a smaller amino acid. It's harder for it to penetrate the brain, so it produces less serotonin that way when people eat too many proteins and too little carbs. This brings the next topic of how to reduce OCD symptoms, is to exercise. And that is also related to this amino acid sizes. That's because when people exercise, their larger amino acids are used for their muscle activity to replenish muscle strength, and so this is decreasing their concentration in the bloodstream, which in turn makes it easier for the small L-tryptophan amino acid to penetrate the brain. But that's not the only benefit. Obviously, exercise also increases your energy levels and helps to get distracted from a problem. Exercising is very good for OCD, psychological, and it's you are the best doctor to yourself, really. What it is just saying that when you catch yourself on this negative thought loop, interrupt it. It's in your power. Tell yourself to think about something else, but obviously that may be hard to work. So you just do something else, or you do something you like, or you listen to music, etc. For people who have OCD, it may be hard to think up at the moment what else to do. So what's recommended is to prepare the list ahead of time. So when you are in this loop, you look at your list and say, oh, I like to do this, I like to do that, and you do that. And that helps you to get rid of this thought loop. And the more often you break it, more effort you put into breaking it, the more likely you are to stop having those thoughts in the future. Guess what? That's great. And then there's obviously a social aspect. We are social creatures. People are there to help us. So talk to some people who care about you, who would like to listen to you. And when you have a problem, you're stuck on some thought, whether it's your body image, or you're worried about something, or even urge to pull your hair, just talk to people. Maybe even leave comments below how you're feeling right now. This will help you to look at the problem from the side, also to listen to a caring friend who's going to give you some maybe good advice or help you get distracted, like into the ice cream shop. Dealing with people, if you're on the other side, if the person who has OCD comes to you, how do you deal with this? Maybe they're going to be argumentative or confrontational, or they're going to keep saying no to you. So how do you feel sane and also build good relationship with them? Because that's all what we want in the end. So the suggestions in the book are, because you probably know people, whether they have OCD or not, but when they're stuck on some idea, nothing can help them. No logic is going to work. So what you do is you try to get them distracted with other ideas, with other thoughts, with something they like. You do it for them if they are really in the loop right now. And then also change subject, use humor, and while you're changing the subject, their subconsciousness is going to process what you said, and if it actually is right, then they're gonna come back to you later and say, oh yeah, let's do that. For people who have OCD, it's important to let them know that the decision they make is what they decided. It's not what you push them to do, it's what they have decided themselves. And you can phrase it in a wise way in order for that to happen. And another tip is to say the opposite. For people who have this defiant disorder, double negation is the truth, is the original statement, right? So if you want them to finish the assignment before tonight, you say, I bet you can't finish assignment before tonight. And so what the person with ODD should say, theoretically, is that, oh yes, oh no, I can finish the assignment before tonight. Or if you want them to do something, you don't want to help me in the kitchen. Well, so chances are they're gonna say, no, I want to help you in the kitchen. Or you don't want to go for a walk with me? Yes, I do want to go for a walk with you. So let them be the one in charge. There's another point, a very interesting book and a series of talks by Voss, who is talking how to negotiate with people. So one point he brings is also cross-appointed with this one, is to let people answer no to you, because when they answer no to you, they feel they are in charge, they feel they're making more decisions, and they are more inclined to give you more information. So this is interesting how you, people from different areas, from negotiations and from neuroscience, came to the same point. Let people say no to you. If you have spiritual life and you're a religious person, that's wonderful. This can help you maybe calm down, bring you to the place where you're familiar and calm. Go to the community of people around you. Today we have talked about OCD, obsessive compulsive disorder, and anterior cingulate gyrus, the part in the brain that is largely responsible for the OCD. We also talked about different kinds of OCD, what are the symptoms, how to deal with them on a day-to-day basis, and also your own with help of others, even possibly with help of psychotherapy. I'm not going to go into the drugs topic because that's a bit too much. You can go see a specialist for that. But in general, for general knowledge, that's interesting how those things happen, what eating helps you achieve what, we are what we eat also. So yeah, that was an interesting topic. If you liked it, put a like in the video, subscribe to my channel for more things education. This channel is all about education, different topics, what you're interested in. Let me know in the comments below, and let me know what you want for the next video. See you next video. Bye.